Okay, so today we're going to be showing you guys how to do a stool specimen test. It's a pretty quick and easy procedure. To start, you'll need a hat, a biohazard bag, a Hemocult developing solution, a wooden applicator, a specimen cup, the test itself, and gloves.
So I'm going to verify my physician's orders before I start, and then I'm going to go introduce myself to the patient. Hi, Mr. Smith. My name is Alyssa. I'm going to be your student nurse today. Can you tell me your name and date of birth? Okay. So today what we're going to do, your doctor ordered a stool specimen. You can either gather it yourself or I can assist you, whatever you're more comfortable with. But we need to check to make sure there's no blood in your stool because the doctor or provider suspects that there is. So what you're going to do is you'll go to the restroom, and if you have to urinate, do that before. Then you'll place this hat on the inside of the toilet. And we want the stool to be uncontaminated, so don't, if you have to like urinate, then just stop and take this out, and then urinate and then put it back, because we need it clean. And if when you're done, you can call me, or if you need assistance, you can call me and I'll come in there. Then after you do that, if either you can or I can, but the stool has to go from the hat into this specimen container, and it needs to be uncontaminated as well. So don't like touch it like with your hand or touch it with anything else in the bathroom. Just this little stick that I give you, and I can give you some gloves as well. Okay. Do you have any questions or concerns? No? Okay. So after the patient, after we obtain the stool from the patient, we are going to put on our gloves, wash our hands, and put on gloves. Okay, so then we're going to open our Hemocult test. And you can see that it has two different sides on it. It's for it's the same test, it's just you're checking it twice basically. So you're going to uncap, and this is not sterile, this is all clean. You're going to get your wooden applicator, and you're going to get a thin smear of stool and smear onto one square. And then you're going to get another wooden applicator, and you're going to get a different section of stool and smear it onto the other square. Just a thin layer of stool will do. Then you're going to discard this in the biohazard. So then you would, after you get the stool, you're going to take your test and close this side and flip it over, open your other side, and put 2 drops of the Hemocult developing solution on the opposite side. It'll have 2 openings, and so it'll be the opposite side that you put the stool on. And so you're going to put 2 drops, and you're going to close the lid, and you're going to wait 30 to 60 seconds. After 30 to 60 seconds, you can open it back up. If either side turns blue, then your test is positive. And this task can be delegated to any kind of nursing assistant. They just need to be instructed that they need to report back to you if the test is positive. So if they see blue on this test, then they need to report it back to the nurse. And they don't need a discard of the positive stool if the test is positive. They need to save it in the biohazard bag and let the nurse recheck the test. Cool.
Okay, so if you don't have a Hemocult developing solution, what you're going to do is the exact same thing that Alyssa just showed you guys, except you're going to apply the stool specimen onto the test, put 1 tablet on each stool specimen, and you're going to apply 2 to 3 drops of tap water on each tablet, and it'll give you the same results that the Hemocult developing solution would. Positive would turn blue, negative wouldn't turn a different color, and that's the difference.